therapist, physical therapist on the internet.
Hi, folks. I'm Bob Schroep, physical therapist.
Brad Heineck, physical
We're
therapist.
one of the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, today we're going to talk about back pain, sciatica. When do you need to see a doctor immediately? Now, we're going to always recommend that you see a doctor to diagnose your sciatica,
Right,
or at least a healthcare professional.
right,
But when these are the instances where you need to see a doctor now.
right. It's very, this doesn't happen very often.
Right.
I've referred two people over 23 years, but it's very critical that you know, and we'll get into it shortly here.
Yeah, this video, by the way, is part of a video series of videos on sciatica. If you want to go see the entire series, go to bobandbrad.com and look for video programs or video series
Right.
on sciatica.
You'll find a button to click and it'll bring you in there.
Yep. All right. So we're just going to start going down the list here, Brad.
Sure.
If the pain travels below the knee and you haven't seen a doctor yet, I'd recommend that. That's probably the least innocuous one, but this is the one I'd still would probably go ahead.
You can have some symptoms to the knee from
Right.
sacroiliac problems, but
arthritis
still,
could even send pain.
right. Even
Right.
a hip can do that.
Yeah.
But either way, seeing a doctor is a good way to get it cleared out.
Yeah. If you're having leg, foot, groin, or rectal area numbness or anesthesia, as we call it,
You're talking about saddle.
saddle anesthesia. Do you want to explain what saddle anesthesia
Sure.
is?
So if you imagine yourself sitting on a saddle, you know, maybe a lot of people haven't, but so the area that the saddle contacts in the groin area, in the gluteal cleft, any of that area becomes numb, tingling. That is an indication that the nerves that are being impinged and irritated is to the point where
They may die.
yeah, it's a red flag. You've
Yeah.
got to get in, and actually at that point, particularly if you're having bowel movement problems, you need to go to the emergency room. It's not
Yeah.
just set an appointment.
This is
and
not
get
the
in.
next day. This is right now.
Right,
'Cause
exactly.
I treated a patient that became paralyzed from this, lost some of the
Yeah.
muscles in his lower
So I actually
leg.
had the worst case scenario.
Yeah, worst case scenario.
I had a person. She had this. She went into the doc. She was a tough one to get to go to the ER, but she had it addressed, and it wasn't. She didn't need surgery.
Sure.
So, but you can't get.
Yeah, you don't know the
have to go
difference.
in, right?
All right, if you're having, along with the pain, fever, nausea, vomiting, stomach
Right.
aches, sweating, these are not normal things
Right.
to have along with back pain. So there could be something a little more, worrisome. And so we want to make sure that you have it
Right.
checked
You
out.
could have an associated infection that
Right.
you can just be treated easily, but one way or another, yeah, back pain and fevers.
Don't mix.
Right. That's
And
not
they
a
shouldn't
mechanic.
they
It's not a
shouldn't go
mechanical
together.
back pain
Yeah.
problem. It needs attention.
And as Brad already mentioned, if you lose control of your bowel or bladder,
Right.
if you're losing control, that's time to go in fast.
That's the emergency room
Yeah.
run.
If your legs are weak, especially if you're like getting foot drop, Brad, you want to mention what foot drop is?
Right. So if you're walking and if you can't pull your toes up like that, and you don't even think about it, when you walk normally, your body just pulls the toes up. If your foot's dragging or it slaps, and you find yourself compensating with your gait with that slapping foot or it's dragging, and you've got the numbness, the sciatica symptoms, you've got to get into to see a doctor because a nerve is being so impinged that it won't even allow your muscles to function. That's later in the stages. That's the severe stage of
and
sciatica.
again, it may not recover if you don't get into it right away.
Right. Don't wait around and hope it's going to get better.
If your pain was caused by an injury, like from a car accident or a fall, then you need to see the doctor.
Right.
Who knows what you might have, a displaced fracture or something that could
exactly
really be causing problems. If your back pain awakens you up at night kind of on a consistent basis, it's always kind of a red flag.
Yeah.
We're worried that, again, there might be an infection or something because generally when you're at rest, a lot of times back pain gets better.
Right.
And if it actually gets worse, that's could be somewhat of a concern.
So if during the day you're moving, in general, it feels pretty good during the day, but boy, by 2:00 in the morning, it continually is aching. You got to see a doctor and get that checked out.
If your back pain's not getting better after 2 to 3 weeks, let's say you haven't gone in at all, I think it's a good time to see a doctor. Maybe that's not an emergency, but it's one that you probably should definitely get it on your list to do.
Exactly.
And finally, if a child or elderly person has back pain, we always being a little more cautious with that. Child, it's unusual for them to have back pain, and so we usually want to get them in fairly rapidly. Or on an elderly person, there's just so many other things it could be. I mean, there's tumors and cancer. I mean, I don't want to alarm you, but there's all these other medical issues that could be.
Right. It might be just that their bones are brittle and they
Right.
sat down too quickly and they had a compression fracture,
right.
which is not a big deal, but it's very painful and it will heal. But there's certain things that make it heal better,
But
and
you want to know it.
yeah, and
So-
with less pain that the doctor can point you in the right direction.
All right. Thanks for watching. Check out our next videos.